colleagues and I introduced a plan to create a new crisis response program in the city of Chicago, which would give residents a non-police line to call for issues related to mental health, substance abuse, interpersonal conflict, and homelessness. We put forth this proposal because the current system has been failing vulnerable communities in Chicago for far too long. We've seen alternate approaches work in other cities, and we know that they can work here too. The current failings are in many ways a reflection of unaddressed mental health needs in Chicago, which stem from structural violence and a lack of access to services that disproportionately affect communities of color. Over the past few decades, Chicago has slashed investment in mental health care, with the number of city-run mental health clinics shrinking from 19 to 5 today. And with police now serving as the first and only response to every problem, including those involving mental health issues, officers continue to needlessly arrest, incarcerate, and kill people in crisis with disturbing frequency. This fuels a debilitating cycle of mass incarceration and instability that only further strains community relationships with police. Chicago police has a bad track record. Efforts at reform has not stopped police killings. We have missed 70% of our deadlines in a court-overseen consent decree overhaul of the police department. Incrementalism is not working. Our communities know it. They do not trust our law enforcement institutions, and they are demanding something different. Nationwide, half of all the people killed by law enforcement have a disability. People with untreated mental illnesses are 16 times more likely to be killed during an encounter with police than those without. In Chicago, about a third of all people incarcerated in Cook County Jail have been diagnosed with a mental illness. Unable to get people the help they need, we have turned to warehousing people suffering from mental illness in cages. Put simply, we are using the wrong tools to address these problems. Police officers are not social workers or mental health experts. And even a 40-hour crisis intervention training program offered by the Chicago Police Department cannot change that fact. We do not need armed responders for public health problems like poverty, mental health, or substance abuse. We must address the root causes of these problems and enact a prevention-based model that works. So much money and resources are directed at locking up people experiencing homelessness or mental health issues and cycling them through the system. That money would be better spent and our public safety better served by providing mental health care or supportive services and housing. With this proposal, my colleagues and I are outlining a new approach to public safety in Chicago, one that aims to interrupt rather than perpetuate cycles of trauma, and to promote emotional healing by providing access to care specifically tailored to vulnerable people's needs. You can't get well in a cell. You get well with proper care in a supportive environment. Our plan sets up a 24-hour mental health crisis hotline within the Chicago Department of Public Health and provides for subsequent expansion of public mental health clinics to prevent and respond to crisis situations. This proposal ensures that social workers are available to respond to crises within the community and connect people to ongoing support through city-run clinics to address ongoing mental health needs. The current system not only doesn't work, it actively makes these problems worse. Chicago can no longer justify spending untold millions of dollars each year on solutions that fail so predictably. We owe it to our constituents, including the most vulnerable members of our communities, to do better. And with this plan, we will. I'm Chicago Alderman Rosana Rodriguez Sanchez, and this has been Dispatches